Welcome back to Primetime News, and a special welcome if you're watching on onespotmedia.com. Up first this evening, more pressure on the country's public health system as there's been an increase in patients with non-communicable diseases seeking care. The confirmation came from the Jamaica Medical Doctors Association, JMDA, which sounded the alarm last week about the high stress levels among doctors working in the COVID ward. The JMDA is hoping that the inclusion of over 100 new doctors will reduce the workload. The president was on TVJ's Smile Jamaica this morning. Anthony Lugg tells us more.
The country recorded over 1,000 COVID-19 cases since last week, and by all indications, the numbers will increase. Healthcare workers have been under pressure, not only providing care for COVID-19 patients, but it's understood that they've also been dealing with an increase in patients with non-communicable diseases who, due to COVID-19 restrictions, had not kept their appointments. President of the Jamaica Medical Doctors Association, Dr. Mindy Fitzhenley, says the double challenge has pushed the health sector in deep waters.
In fact, I would say we are already underwater. So what we desperately need is some more bodies on the ground. And as you know, there were 107, at my last count, 107 medical doctors who were not employed at the time, and they are to start this morning. So we are hopeful that these persons will be able to bolster the system because they have been employed in a number of different areas, not only in primary care but also to different hospitals.
Dr. Fitzhenley says healthcare workers have been under tremendous strain since March, but the surge in cases in the last few weeks have led to a dire situation.
Well, we still continue to do as best as we can. As you know, both the doctors and the nurses and the public health team, we are one team, and so we're all in this together. But the issue has been that as the numbers continue to increase, it's becoming more difficult for us to manage the load that is coming into the hospital, coming into the health centers. And until the actual number of bodies of us increase, it is becoming very, very difficult for us to continue in the same manner that we have been.
There have also been reports of doctors being infected with COVID-19. The JMDA president says difficulty accessing equipment during high-risk situations were contributing factors.
So what happens is, although the personal protective equipment may be there in stores or in another location, sometimes it's difficult to get it immediately as you need it. Mm-hmm. And so, we are in the business of saving lives. Persons need to be resuscitated. You may not have the correct mask that you need, and at the time, the person was not identified as being COVID positive. So, we've had experiences where persons are doing everything they can to try to save somebody's life, and then only afterwards, when the COVID test comes back, it's positive. And although the person would have had on a mask, it wouldn't be the specific mask that you would have needed to interact with a COVID positive patient in such a high-risk situation. And so, unfortunately, we are also losing a lot of our doctors into quarantine, isolation, or because they are getting a positive result.
Anthony Lugg, TVJ News.